attendees. So I'm Sunny Prajapati. I'm a PhD student in Ramanbhai Patel College of Pharmacy, and this is a part of my PhD project. Today I'm going to talk about a study titled Prevalence of Non-Alcoholic Fatty Liver Disease in Type 2 Diabetes Patients and Evaluation of ADR. This is an observational and ambidextrous study. So NAFLD is an important contributor of chronic liver disease and can advance to severe liver disease. So unhealthy lifestyle, obesity, and uncontrolled diabetes are the major contributor. And widespread availability of calorie-rich foods, lack of physical activity, and with combined modern epidemics of T2D and obesity. So various drugs are available, biguanides, sulfonylurea, DPP-4, SGLT2, thiazolidinediones, alpha-GI, insulins, and GLP-1RA. So saroglitazole is the one and only approved drug for NASH and NAFLD in India by DCGI. So this is, as I said, ambidextrous observational study. We have enrolled 1,500 type 2 diabetes patients which were on anti-diabetic medications and were evaluated for prevalence of NAFLD, and ADRs were evaluated. So two sites were selected, RIMS Ahmedabad and Rudraksh Bareja. Total study population was 1,500 patients, and the duration was for 2 years. So inclusion was above 18 years and with or without NAFLD, but of course must be on anti-diabetic medications. Exclusion, we have not included pregnant women, malignant conditions, acute communicable diseases, and below 18 years. We obtained ethics committee approval before initiation of the study. Study procedure, like we have collected data, demographic, age, gender, BMI, weight, height, diagnosis, and duration of diseases, and all data were descriptively summarized in MS Excel. So this is result out of 1,500 T2D patients, 621 patients were identified diagnosed with NAFLD, that is equivalent to 41.4%, and in which 216 patients were identified with at least one ADR, that is 34.8. And if I talk about patients without NAFLD, then it is 879. Although patients were higher, but if you look at the number of ADRs, then it is less in comparison patients with NAFLD. This is demographic distribution with respect to sex distribution. Of course, number of patients were higher in male, but if I talk about comorbid condition of NAFLD, then female patients were higher, and that is equivalent to 54.9%, and number of ADR was also higher in female, that is 128. So 37.5% was the ADR occurrence for female patients. With respect to age distribution, 51 to 60 years age group had a higher number of T2D patients, so NAFLD as well. But so if we talk about the ADR occurrence, then also ADR occurrence was higher in this age group. With respect to BMI distribution, obese patients had higher number of NAFLD patients, that is equivalent to 62%, and ADR was also higher in this subgroup. With respect to comorbidities, if the comorbidities are more, then of course ADR were more, that is 38.70%. This is a very busy slide. We'll talk about the prescribing pattern. So which drugs were used mostly for T2D and NAFLD. Then mostly biguanide was used, followed by DPP-4, sulfonylurea, TZD, and SGLT2, alpha-GI, insulin, and saroglitazole, of course, because we are talking about NAFLD here. So 613 patients were given biguanide, that is equivalent to 34.9%, and followed by DPP-4, 34.7. With respect to nature of ADR, so mainly ADR observed was GI disturbance, that is 86 number of patients and equivalent to 39, almost 40% patient had GI disturbance, followed by weakness, headache, tiredness, hypoglycemic events, sleep disturbance, burning and painful urination, restlessness, uneasiness, decreased appetite, various. This is number of ADR events versus name of the drug. So metformin was given in 360. I mean, the patients which were given metformin, those patients have observed with 360 number of ADR events. I mean, see, one patient had GI also and weakness also. So this will be considered as 2 ADR events. So metformin has the highest number of ADR events, followed by pioglitazone, glimepiride, sitagliptin. See, this drugs were given in combination as well, in the combination of FDC of 3 drugs, 2 drugs that I'll talk about. So this is a class and the name of the drug versus ADR event. So bigunide was given the most, followed by DPP-4, that is 288, and TZD. So with respect to discussion, of course, prevalence was higher, that is 41.4%, and which is also aligned with previous study, that is 21 to 78%. Higher rate of ADR, that is 34.8% in patients with NAFLD, and if we consider without NAFLD, then it is 24.4%. Now, NAFLD was higher in female patients, 54.9, so as well ADR occurrence was also higher in such female patients. Of course, we have observed age-related trend, that is a higher prevalence of NAFLD in 51 to 60 years of age group, and ADR was also observed in 51 to 60 years of age group. Higher prevalence in obese patient, that is 62%, and 139 observed more ADR. Overweight has 74. So this is already I covered. So all the ADRs we have classified possible because they were given one or more drugs, and I have a limitation for this study that we have conducted this study for in just 2 hospitals. So larger multicentric trials can be done for a greater sample size. So this is last slide conclusion that higher prevalence, particularly in female and older age group, and as well as individuals with obesity and with multiple comorbidities. Thank you. These are references. Thanks for the patient hearing.